What was this episode about? I wanted to discuss a MS symptom that I've been having like a bigger struggle with lately, especially with me going from pneumonia straight to COVID. I figured like it had to be something deeper with my MS playing some type of a role with these respiratory issues. So I turned on my inner millennial and I hopped straight onto Google, and I found out that what I was feeling actually is a thing and has a name. Like it's called MS hugs. Hey everybody, what's up? It's your homie, the one and only. You already know who it is. Yeah, I'm trying to get me a nice little like catchphrase together or whatever, like all these other YouTubers have, because I just feel like, yeah, just working to be a big YouTuber, okay, y'all. But no, let's go ahead, let's get into it. Now, I know you're thinking, what is MS hugs? It sounds great, right? It sounds as if it's this warm, like comforting feeling of being bundled up like a newborn baby all swaddled up, but sorry to disappoint, it's not. According to mssociety.org.uk, MS hugs is a symptom of MS that feels like an uncomfortable, sometimes painful feeling of tightness or pressure, usually around like your stomach or your chest. The pain or tightness can stretch all around the chest or stomach. Or it can be just on one side, oddly enough. The MS hug can feel different from one person to another, though. Keep that in mind. Some people have even compared their pains from MS hugs to that of like a too tight belt or whatever, on like other things like an actual unwelcoming hug, or even as bad as pregnancy contractions. Now hold on, because I've been through pregnancy already. I always tell people like, oh, I'm one and done. But some days when it comes to this MS hug symptom, like it feels like I'm in competition with Octomom or something. Like it just doesn't stop. But no, let's get serious and let's talk about this evil hug, quote unquote. First things first, what causes and triggers this symptom to come about besides just having MS? Well, it's noted that fatigue, stress, and changes in temperature can indeed get this symptom started up. But keep in mind, it's not just specific to MS. It can occur with like spinal cord inflammation and as well as transverse myelitis. Now, pause. Because some of us aren't like familiar with transverse myelitis, or at least I wasn't until now. So it's a dictionary moment, y'all. Let's go ahead, grab the good Webster's out. But according to hopkinsmedicine.org, transverse myelitis is a disorder caused by inflammation in the spinal cord, and is characterized by symptoms and signs of like neurologic dysfunction in motor and sensory tracts in both sides of the spinal cord. The Mayo Clinic also says transverse myelitis can be the first sign of multiple sclerosis or even represent a relapse. When it's seen as a sign of MS, it usually causes like symptoms of like only on one side of the body, oddly enough. Now, me personally, hearing that it can be a sign of a relapse and knowing that I haven't had my Gilenya MS medication in almost 5 months now, I'm worried. I just really hope I'm not coming into another relapse. I was paranoid and thought I had a relapse starting up recently, but then come to find out it was just COVID. But still though, to this day, this MS hug symptom is still bothering me and making me uncomfortable all of the time. It's not too far on like the painful side yet for me, or just like sometimes only on some days, or when I'm like sitting too long in the same position, it feels like it comes in like right after my joints start locking up or whatever. Like I'm in a really cold, chilly like area too long too. That's when it feels the freaking worst, you guys. It makes me just want to curl up into a ball and just like get as small as I can and like just stay there until I start feeling different. Not better, but just some type of different. Now I know that was deep and a lot to take in, but now that we know, let's keep going. And let's go ahead and let's see like what can we do, what can be done about these like fraudulent hugs. Yes, I called them fraudulent. But for real though, honestly, not everybody can figure out or identify what triggers their MS hugs. But if you do know, what your triggers are and whatnot, you might be able to minimize it or even like avoid it altogether, honestly. um mssociety.org.uk has a section in their article on MS hugs titled How to Manage the MS hug. Now, there's no guarantee that you'll be able to get rid of it completely, but there's tips to help manage it a little bit better, you guys, when it comes about, like you might have to do a trial and error run through some techniques to find out like what helps and what works best for you. Or you might find a nice little combination of things to do to help you, You never know. Like I always say, the possibilities are endless. So let's go ahead and let's talk about some of these options, okay? The list in the article names these things to help. 1, looking for triggers. We just went over that. Triggers can be just everyday stress, the evil villain named fatigue, or even when it feels like Mr. Heatmiser and Jack Frost are fighting inside you, changing body temps and whatnot. But if your triggers aren't obvious, just keep trying to keep note, and like a nice little journal of things like how hot or cold you feel, how much stress you're feeling, how tired you are, what you eat, and just about whatever you think plays a big enough role in your everyday life. Just write it down. You feel me? Like, you just have to keep track and compare the different things that might play a role in you feeling this symptom, that'll help. But number 2 says wearing loose or tight clothes can make a difference. Tight clothes seem to trigger the MS hug for some people. It might make it worse when it happens, honestly. So it makes sense to try wearing looser clothes. Now, I'm not saying to take it back all the way to the early 2000s. In a white tee, your big oversized white tee, you feel me? Or you don't even have to take it back to with the baggy pants, back to the hammer days. But no, just loosen up a little, I'm definitely taking this into consideration with my new clothing line I'm working on. I know how important how clothes fit really is for everyone, especially those of us with chronic illnesses and disabilities. But just as much as loose clothes can help, as odd as it might sound to you, tight clothes can help others the same way. Like, really. Here it says that tight clothes can actually help some people deal with the MS hug. This may be because the grip of the tighter clothes distracts the brain. Yeah, it distracts the brain and makes the MS hug sensation less obvious, You can't really feel it that much. With me being as small as I've gotten now, unintentionally, by the way, I didn't try to get this small. I'm not dying. I don't know what's going on with my body or why I'm 30 pounds under my old average weight. But I'm a female who likes to wear my clothes at least a little fitted, even though I have no curves at all, just flat, But sometimes layers are my cause, they're my triggers. The ladies can relate to what I'm about to say, but you know that feeling when you take your bra off at the end of the day and it's just that tingly release ease it brings to you, to your torso and everything. Y'all, I'm sorry. It's just such a great feeling to me, for real. But no, even certain materials can make me uneasy. I thought about doing a video, honestly, on my best comfy outfits. You guys seen the one I had on in my COVID video, but that's a discussion for a different day. But no, moving along. Number 3 is moving and stretching. I'm so big on trying to move around and everything, just when I feel my body just starting to get tense and tightening up, I'll get up, I'll twist around, move my arms, just everything that makes me look like I'm doing good, great yoga, even though I don't know much yoga yet. But no, if you're not big on movement, or if you're a bit restricted with your movement, number 4 says that you can just easily apply hot or cold to the area where you feel the sensation and everything. You can use anything like a heat pad, a cold pack, or maybe even meet it in the middle and use some icy hot right there, I'm just saying, if you ask me, I'm not a medical professional yet, and I feel like it shows. But no, the next one suggests trying some physical treatments for your MS hug, Physical treatments include like physiotherapy, some complementary therapies, ooh. Or you can even try transcutaneous electrical nerve stimulation, which is basically when they stick like electrodes on you, those little sticker patches, and they just give it a little, like zap, 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 zippity zap, like on your body in certain areas. But no, next there's also like you could try relaxation, distractions, mindfulness, and CBT. Even the site admits that like this is really like easier said than done, honestly. But it says the MS hug is easier to handle if you just keep calm and even like relaxed about it, honestly. I just feel like though the site admits that this is like easier said than done. Just because this seems like more of like a mental technique, if anything, to me. But then it lists like some techniques to try, like excuse me, like I said before, you can try distractions, mindfulness, self-hypnosis, hypnotherapy, like controlled breathing techniques, and even CBT, which is cognitive behavioral therapies. Now pause, quick CBT. Basically, this is like working with a therapist to help you identify, question, and challenge some of the negative thinking patterns and everything, and some behavior patterns that like might just be like causing your difficulties. But no, if you're still not feeling any of these techniques, you honestly, you guys, you honestly could always try drugs. But no, I don't mean like drugs. I'm not even like comfortable saying it like that, so let's just call it medicine for real. But no, MS Society says if your MS hug is caused by like unusual sensations or dysesthesia, medicine treatment could really help you, honestly. But when your MS hug is a like symptom of relapse, steroids or the real drugs might just help speed up like recovery. But honestly, nonetheless, seeing a medical professional can be like a lot of help for real. Like letting your primary care physician or just any doctor that you really trust, like with your health and everything, like just let them know exactly like what you're feeling, how it feels, like just like that's the start of like getting help, because then they can go ahead and suggest the best ways to help manage it and the symptoms that you're feeling and whatnot. At least that way you can get like a second opinion and you don't have to rely on Dr. Brian to diagnose you. But no, like for real though, like I'm going through this and I'm still looking for help in different ways to just get a grip on this invisible grip around me. But have a seat with me, you guys, real quick. Let's have a talk. No. Have a seat with me real quick, you guys. Let's talk. But no, for real, like honestly, I just like I find myself like really like constantly trying to adjust my posture, stretch. Like sometimes like even I'll like crack my back on like a chair or whatever as I'm sitting down and whatnot. To me, it feels as if like I'm in like a scary movie. And like I'm just like that one girl that didn't run fast enough, and the darkness or whatever got me, and it's just like holding me or just pulling me into the room or whatever. Or it feels like sometimes like I'm the lady that's being carried by King Kong as he comes to the top of the building. Like, but no, like this something definitely plays a big role in like my body like not feeling like it's my own. Like I just feel like my body has its own agenda and everything, honestly. Like to me it's just like I don't know. I feel like a puppet. And I feel my puppet master pulling on each of the strings, like controlling me. It's really weird. Like I'm usually really good with analogies, but this one this is one of those if you know you know type things. But like honestly, but just nonetheless, I really hope that this like I got my point across. I hope everyone learned something from this, and hopefully best like case scenario you found something to apply to your life to go ahead and help you. If you enjoyed this though, please give me a like down below. And if you enjoy my content, or if you think I'm funny, or even if you just think I'm cute, don't forget to subscribe for me, please, 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 please. I'd appreciate it so much. But it's been a great time, you guys. But now it's time for so long. Hey, just tell me sing one more. We're not doing okay. Copy. Okay, that's fine. But always remember, just stay safe, stay clean, and Prion loves you. Bye. Let's get it. Yeah, they call them big breezes.